Oksana Pyzik. She's the lecturer over at the School of Pharmacy at the University College of London. She joins me now. Good to have you on the show, Oksana. It's been a while. What's driving this rise in cases across the continent?
Well, there's a couple factors at play here. First, we have Delta and Delta Plus, which is even more transmissible than the Delta variant, combined with the changing season, meaning that people are being driven indoors, a very relaxed summer in which people did to some extent drop guards on intermingling. In many European states, they didn't start to really introduce a more strict measures or things like vaccine passes until the beginning of the fall. So we're seeing a cumulative effect of spread, and this is putting pressure on healthcare systems, which is why some countries are taking more drastic measures, as we've just heard.
How much of a role do you think that sort of anti-vaccine campaigns are playing in this recent surge?
Well, those that were willing to be vaccinated came forward early, and so many countries hit very high target rates quite early on in the pandemic, depending on accessibility, of course, within Europe. But now we've seen for quite a long time a plateau. So if we look at places like Austria, only 65% of the population has been vaccinated. And it just shows that the government's public health and outreach campaigns have not been very successful in convincing or persuading vaccine hesitant and anti-vaccine groups that have gained a lot of ground. Particularly through being able to spread misinformation at a rate that's almost impossible to fact check via social media platforms.
So if the outreach programs haven't been successful, I guess, then returning to lockdowns seems to be the best option. Are we going to see more of them across the continent?
Again, that's going to really land on the shoulders of the leaders and their appetite for these types of measures. And we see that that's something the UK is firmly against. But they have, when relying on, even vaccines by themselves are not going to be enough. You need a vaccine plus strategy. And it's good news that molnupiravir has some promising potential to be added to the toolkit, but isn't available widely yet. And there's going to be production delays. I think that the UK strategy has been really just resting on boosters and the potential to have access to molnupiravir. But even here, despite the rhetoric, there are pressures on the healthcare system. So as a result, if we don't have a successful increase in uptake, little room for maneuver is left. I think nudging policies, many public health leaders have been trying to lead with incentives, with the carrot rather than the stick, but it's just not budged that number. We need to be well above 70, 80% to be fully protected.
Okay, Oksana Pyzik, thank you very much for joining us. Enjoy your weekend. Thank you.